start. As India's healthcare landscape evolves, the future of impact lies beyond metros in Tier 2 and Tier 3 cities where accessibility meets innovation. This presentation will explore how advanced care, affordability, and scalable delivery models are transforming regional India into a healthcare powerhouse. Please welcome Mr. Gaurav Khurana, Group CEO, Amandeep Hospital, presenting the new Healthcare India, making advanced, affordable, and accessible care and reality in Tier 2 and Tier 3 cities. Welcome, sir.
Thank you, Medgate, for inviting me. If I can have the audience seated, so I can just start. So good afternoon. If I can have everybody seated, I'll start. So I'll just start my topic. The topic given to me is advanced, affordable and accessible care, a reality in Tier 2 and Tier 3 cities. So we've been doing it for the last 36 years. Amandeep Group stands there since 1990 and we've been doing it for the masses, and we have made it accessible, affordable, and similarly the advancement that have come into healthcare sectors, we have been at the forefront to bring those technology in front. So we started with a small 5-bedded nursing home at GT Road, Amritsar. There we had a small building. Both our founders were clinicians. One was a pediatrician, Dr. Amandeep, and the other one, Dr. Avtar Singh, his spouse, the orthopedician surgeon. They brought that dream that they would not like to go out of Punjab and bring the best technology that is available across the globe to that territory and bring the best as fast as possible. So we have 6 hospitals as of now. We have 2 hospitals in Amritsar. Both are 200 beds now. We have one at Pathankot, which is a 150-bedded hospital. We have Taran, which is a small unit, 50-bedded. Then we have Firozpur, which is started last year only. It's a 150-bedded hospital. And then Srinagar, we have just started in the valley. It is again a 200-bedded hospital. So this is a small journey that we have taken for the last 36 years and still continuing to bring the best technology possible, best of the talent to across all our hospitals. So we started with a nursing home with a 5-bedded hospital in 1990. Then we advanced it to 2001. We had the first advanced trauma and replantation of amputated parts center in the region. So that was the first thing that we started. So we were known for any kahin ka koi ang kat gaya hai, so best possible to reach out from Jammu, Kashmir, Himachal, Punjab. The first thought was that we should go to Amandeep Hospital, we might be saved. So that was one thing that we brought in. Seeing that the clientele is coming towards from Jammu, quite a lot of people were traveling towards Punjab. We made an OPD center, an outreach clinic, so that patients can have the best of the talent available at the Jammu unit, which is all our doctors on a fortnightly basis are available there. So some of the doctors are available always, and there is a medical room, so we can take care of anything, any exigencies. A stationed mobile ambulance is there, so we can transport the patient. At least the basic things are given, and then we transport the patient. Then we started in 2012 an OPD clinic at Firozpur, because we saw that we are getting quite a lot of patients from Firozpur unit. So we wanted to be near that center also. So there we still have the OPD running, despite our own hospital coming in, but still we have not closed our OPD center, because the center that we have made, the hospital that we made, is on the Moga highway. So we wanted to be in the city, that Firozpur city also, it becomes a feeder for any of our hospitals coming to the hospital. Then in 2015, we launched our Amandeep Pathankot Hospital. It's a 150 hospital. It's a multi-specialty. Seeing that the flow from Jammu is quite high and many people are not able to reach out to Punjab, they are not able to reach till Amritsar. So we wanted to a hospital in Pathankot, where we have the best of the critical care team, we have the best of the doctors available, the best of the talent, nurses. Then seeing that after terrorism, we saw a quite surge of drug addiction happening at Punjab. So the philosophy of our founders was that at least we should give them some kits, we should give them something to keep playing. So we made a first day and night stadium in 2015 by Amandeep. There we were training. We have a training program coming for any of the child who wants to come into the academy. We are training them free of cost. We have distributed 10,000 kits for the people so that they involve themselves into something playful. Then, most important factor, most of the nursing leaders said that there is a scarcity of nurses, qualified nurses and good quality nurses are very scarce. So we wanted to bridge that gap. We made up our own College of Nursing, and that came up in 2016. We started with 50 seats. Now it is full-fledgedly doing 100 seats. So here we have that 4-year program running. So we have a simulation lab there. So any of the nurses across Amandeep are also trained for 15 days there. They go in for a simulation lab. Once they are trained, once the orientation is completed, then the 15 days is a buddy system in any of our hospitals that they will go into the hospital. They'll be a buddy to somebody senior, and after 15 days only they can handle a patient. So that robustness we have brought into that. In 2018, we came up with a new hospital at Amritsar, seeing that the 200 beds is getting scarce and we are not able to cater to many patients. And this was more of a trauma center, the first center that we had. We wanted to bring cardiology, pulmonology, the medical side also. So we came up with Amandeep Medicity in 2018. This is a 200-bedded hospital. Then we had something from the border, like we had covered Pathankot, we had covered Firozpur. So we saw the gap at the third border towards Taran, where patients are getting hurt and they are not being able to get the best of the treatment. We came up with Amandeep Kamal Hospital, a 50-bedded hospital. It's just 40 kilometers from Amritsar, but at least the basic things can be provided. And any high-end thing that has to be provided is taken care at the Amritsar units. Then in 2024, we signed an agreement with Cancer Centers of America. This is to bring the onco setup, because if you see, maximum number of patients coming to Delhi of onco are from Punjab. There was a train when I was with Rajiv Gandhi Cancer Hospital. There was a train which was known as the cancer train that was coming from Punjab. We wanted to bridge that gap. In 2024, we had our full-fledged comprehensive PET-CT, radiation bunker, medical oncology. Now we're going for a bone marrow transplant also. So there we had got this option. In 2024, we came up with our own flagship hospital at Firozpur again. We already had an OPD center. Seeing the volumes that we were getting at Firozpur, we came up with a hospital there, a 150-bedded hospital. It's called the Amandeep Multi-Specialty Hospital. We have 20 beds of trauma. We have 12 beds of ICU, and it's a 150-bedded hospital. Then we saw that many patients are coming from the valley, and many of the patients cannot reach Amritsar on time. So we came up with a hospital, and Amandeep BR Medicity is stationed there, 200 beds. We started last September, and we are doing good. So we wanted to bring something for the valley. And in 2025, recently in April, we had a strategic partnership with Ujala Cygnus. So they are strategic partners with us, where the funding is from General Atlantic. It's a US-based company. And seeing that we have to grow further, we wanted some funding. It cannot happen with the private equity that we have. So we came up with that option, and now we have the strategic partnership going on. And very soon we have 3 locations coming in. We have Jalandhar, which we have shortlisted, and we are already into brownfield projects for Jalandhar. Tri-City we have closed, so we wanted a flagship hospital at Tri-City. seeing that we should also be present there. And similarly, Ludhiana. Ludhiana is also in the key. We have not finalized any hospital. It can be a brownfield project, it can be a greenfield project. So we are not sure about Ludhiana as of now. But for Jalandhar and Tri-City, for the next financial year, we'll have two hospitals coming in. Then we are the first to start any surgical program across. This is about the partnership and the specialties that we have. We have everything across, you name it, and the technology is available with us. We have 36 years of experience and into healthcare and 600 plus doctors, 25 lakhs we have already treated patients, and we have the capacity as of now with Ujala Cygnus coming on to roll, 2,200 beds of Ujala Cygnus and 800 beds of us, makes it 3,000 beds in North India. This is the strategic partnership that was signed in April 2025. So now our aim is to bring those 3,000 beds to 5,000 beds by 2031. So that's a very phenomenal growth that we look at. We wanted to cover many parts which are still not touched. And with the technology that we brought in, we want to touch to the masses and be there wherever we want the patients to be there. This is the vision. The founders, Dr. Amandeep Kaur, she is a pediatrician by qualification. She left her practices, took the back seat, and by the time her son was doing his MBBS, she graduated with the Masters in Hospital Administration. So both of them working together. Their son has joined us in 2019, Dr. Shabaz, and Dr. Aftar, he is a well-known figure in orthopedic surgeries. Most of the robotic surgeries and artificial intelligence we are doing with him. With the tie-up that we got in Ujala Cygnus, Dr. Avtar Singh became the chairman for the entire group for driving anything and everything in the orthopediction center. So all the 20, 30 hospitals that we have will be governed by Dr. Avtar, and we will have the best of the practices coming from the scratch, that we will be reframing all the policies and everything will be done there. So he has a very good track record. We have performed more than 1.55 lakh orthopedic surgeries in the past 35 years. And we have done more than 5,500 successful AI robotic transplants under him. And with joints, we have done more than 35,000 since 1990. And we take the pride that we are the second hospital in India to have introduced the 3D printing and virtual reality. And in the territory, in the region, we are the first hospital. Being into Tier-2, we can compete with any of the hospitals in the metro. These are the scope of services that we have in our hospital. You name it, and we have the specialty. These are some things which we are passionate about, the technology. So AI robotics we had by 2015. We were the 5th hospital to get robot in the country. Neuronavigation, we brought it in 2018. Hyperbaric oxygen therapy, which till Delhi, in the region, there was nothing. The closest after Punjab is Gurgaon and Delhi NCR. So we take pride that we were there. In 2015, we had brought hyperbaric oxygen therapy. Mammography is one of the important things when we are doing cancer. So IVUS we brought for our cardiology. We are doing good on the cardiology front. So this IVUS model is shared between 3 units. So it's not that we have kept into mind our return on investment also. We cannot just go for the technology and not have patients. So we rotate this IVUS machine between 3 hospitals, Firozpur unit, Pathankot unit, and our Amritsar unit. So every 10 days it is rotated, and whatever number of IVUS numbers have to be done in these 3 units can be done. We have the AI assisted cath lab. EBUS we have brought first in the region again for pulmonology, the best of the technology that is required. EUS, nobody else in the territory has it, but we brought it because we wanted the best of the clinicians should feel that they have some upper hand when they're doing, and we would not like to send any patient outside the hospital, be it to any metro. Radiotherapy, like I told, we already have, and this is just there. Laser, and now we are also coming with a soft tissue robo, which is going to be there by March. So the next financial year, we will be starting the soft tissue also. In the first time in the region, we also coming up with the kidney and heart transplants. So while we talking, yesterday we had our inspection for the heart transplant, and most of the things were all okay. Some minor things that were required from the committee, we will be more than happy to close it. And we expect the next financial year, to have the kidney and heart transplant. So we will be the first to have interventional radiology and interventional neurology also in Tier 2 and Tier 3 cities. Now, with responsibility, it comes our responsibility towards the society. So we have CSR activities happening. It cannot be that we are only a commercial hospital in Tier 2 and Tier 3 cities. So we have a reputation that we do free OPDs for staff. We have done many. One is Durgana Mandir at Amritsar. One is the Jeho Clinic again. Then CAT-free mobile OPD is an initiative, a CSR wing of Amandeep Hope, which they go to, we have taken pins in Punjab. The villages are adopted by us, 90 villages. We have our camp team reaching there, meeting them, giving them free medicines, and we hold free medical camps and do whatever is required, we do that. And all patients cannot be affording, for sure. So we have this Aman Ki Asha. The Aman Ki Asha is a program where we do 50% subsidy to any of the people coming from below poverty line. So there we are treating many patients. We also have a crowdfunding activity happening in our city. We started it last year. We have done crowdfunding for 18 patients till date. Social messages, of course, we are doing so that the masses are aware about what is happening. Then for the females, we also go in for the first aid and the menstrual hygiene seminars in rural villages. Then blood donation camps is a routine for any of our hospitals. We keep doing that every month. Smile Tain project, which is a big platform. So we have that also, and we've treated more than 10,000 patients since 2015. Then we have an artificial limb center where any patient who's lost his limb can get it free of cost, and we do, and sometimes it is subsidized, sometimes it is free of cost, depending on the economic standard of the patient. Then we have distributed quite a lot of sport kits under the slogan Nashe to Mukte Karko. So there we have given it to the Gram Panchayats that they can involve the youngsters into cricket playing. We have distributed 10,000 kits of cricket. So this is what we keep doing. For the education, we have trained the youth, and now we are approved for DNB, DRNB, FNB and diploma courses. And these are currently available at our 2 centers at Amritsar and 1 at Pathankot. These are the OPD ambulances which go through Amandeep Hope, the CSR wing, that was launched in 2020. Aman Ki Asha, like I was saying, room rent goes down to 800 rupees. Whatever is the room rent, it goes down to 800 rupees. 50% discount on any of the surgeries that are to be done, and the ICU, and 20% discount on medicines, and 10% discount on the test. And apart from that, there are many places where it's not a BPL patient. Patient has come for a treatment, he cannot pay immediately. We have a 0% EMI facility available across all our 6 units. He can avail it at 0% interest. It goes from 40,000 to 14 lakhs of rupees, depending on the credit score. And EMI payment option comes from 4 months to 18 months. We've launched a joint freedom drive this year. We've just done the press conference. it is for all the poor and deserving patients across Punjab. So I'll request all the masses also to give this message to anybody who's requiring a free joint replacement surgery. So 26 is deriving from the year 26. So we'll be doing the entire year 26 joint replacement surgeries, which will be free of cost. Nothing to be paid. Every patient, it should be a BPL patient for sure. These are some awards and accolades that we've got. That's about it. And coming to nursing, where we were talking to all the nursing leaders. So my take on the nursing leadership is that we should surely have a system where we can train our staff before they are going in to take care of the patient at the bed. The simulation labs, we have a robust 15 days orientation program for any of the nurses joining Amandeep Group. And then we have a nursing college. So even after the training, we keep them 15 days with somebody senior as a buddy, and then they can take any of the patients. So in a nutshell, the hospitals, I'll cover it into DNA, where you have the DNA of the body, doctors, nurses, and administration. So nurses being the Felix, where we see that they should be there. So we should surely empower them, and full respect to the nursing leadership program. Thank you very much.
Thank you so much, sir. I would like to call on stage Mr. Afzal Kamal, sir, and Rudy Gold, sir. Sorry, he's not here right now, so I would like to call on stage Afzal Kamal, sir. Ladies and gentlemen, please round of applause for them. Thank you so much, sir. Thank you.